Wash your hands. Since COVID-19 has never been found in people, there are at present no antibodies to forestall or medications to treat COVID-19 endorsed by the U.S. Food and Drug Administration. The most ideal approach to forestall disease is to abstain from being uncovered, or uncovering others, to this virus. To start with, practice straightforward cleanliness. Wash your hands routinely with cleanser and water for 20 seconds, particularly after heading off to the restroom, before eating, and in the wake of hacking, sniffling, or cleaning out your nose. Figure out how to wash your hands to forestall the spread of coronavirus and different sicknesses. If cleanser and water are not accessible, the Centers for Disease Control and Prevention suggest that buyers use alcohol-based hand sanitizers containing in any event 60% ethanol, otherwise called ethyl alcohol. The FDA keeps on notice buyers about hand sanitizers that contain methanol, additionally called wood alcohol. Methanol is extremely harmful and ought to never be utilized close by sanitizer. If consumed through the skin or gulped, methanol can cause genuine health issues, for example, seizures and visual impairment, or even demise. Before you purchase hand sanitizer or utilize some you as of now have at home, check this rundown to check whether the hand sanitizer may conceivably have methanol. Most hand sanitizers found to contain methanol don't show it as a fixing on the mark, since it's anything but an adequate fixing in the item, so it's imperative to check the FDA's rundown to check whether the organization or item is incorporated. Keep checking this rundown often, as it is being refreshed every day. The FDA has likewise extended the rundown to incorporate hand sanitizers that contain different pollutants and items that have not exactly the necessary measure of the dynamic fixing. If you have a hand sanitizer on FDA's rundown, quit utilizing it right away. Figure out how to discover your hand sanitizer on the Don't Utilize rundown and how to securely utilize hand sanitizer. Wear a mask and avoid crowds. Remain at home however much as could be expected. Dodge close contact, in any event 6 feet, or around 2 manageable distances, with individuals who are not from your family, regardless of whether they don't seem debilitated, in both indoor and outside spaces. A few people without manifestations might have the option to spread the coronavirus. The CDC suggests wearing fabric covers or face covers, not careful veils or N95 respirators, out in the open, particularly when other social removing measures are difficult to keep up, for instance, at supermarkets and drugstores. Wearing fabric face covers or non-careful covers in broad daylight can help ease the spread of the virus. They can assist with peopling who may have the virus and don't have any acquaintance with it from sending it to other people. Fabric face covers are prescribed as a basic hindrance to help keep respiratory beads from going into the air and onto others when you hack, wheeze or talk. Figure out how to shield yourself as well as other people from coronavirus. Spare personal protective equipment for those on the front lines. Try not to purchase or stock up on close-to-home defensive gear, for example, careful covers and N95 respirators. Careful covers and N95s ought to be saved for use by healthcare laborers, specialists on call, and other forefront laborers whose positions put them at a lot more danger of being tainted with COVID-19. Follow food safety guidelines. The U.S. food gracefully is protected, both for individuals and for creatures. There is no proof the coronavirus is communicated through food, food holders, or food bundling. As usual, it's critical to follow the 4 key strides of sanitation: wash, isolated, cook, and chill. Give blood. Another approach to help is to give blood if you are capable. The U.S. blood gracefully is confronting extraordinary difficulties and deficiencies. Contributor focuses have encountered an emotional decrease in gifts due to social separating and dropped blood drives. Keeping up a satisfactory blood flexibly is crucial to general health. Blood givers assistance patients, and sorts, mishap and consume casualties, heart medical procedure and organ relocate patients, and those engaging malignancy and other life-compromising conditions. The American Red Cross gauges that at regular intervals, somebody in the U.S. needs blood. If you are healthy and feel well, contact a nearby gift community to make an arrangement. Gift focuses are finding a way to ensure gift is protected. If you have fully recovered from COVID-19, donate plasma. Individuals who have completely recouped from COVID-19 are urged to consider giving plasma, which might help spare the lives of other COVID-19 patients. COVID-19 patients create antibodies, proteins that may help battle the disease, in their blood, COVID-19 improving plasma should possibly be gathered from recouped people if they are qualified to give blood. COVID-19 healing plasma can be gathered from people who have had an earlier analysis of COVID-19, which is archived by a research center test, and who meet different qualifications. For instance, they should have completely recuperated from COVID-19, with complete side effects for any event 14 days before gift. A negative lab test for dynamic COVID-19 infection isn't important to qualify for gift. Further examination is important to decide whether gaining strength plasma is sheltered and compelling as a treatment for COVID-19, and whether it may decrease the recurrence or length of disease, or forestall passing, related with COVID-19. Approaches to decrease your family's chances of getting the coronavirus. If you're a parent, you're most likely stuck to news inclusion of the coronavirus, and the disorder it causes, COVID-19. It has spread to essentially every nation, sickened more than 34.3 million individuals, and caused in any event 1 million passings. There's additionally been more than 7.3 million affirmed cases and 207,600 passings in America. It's normal for guardians to stress simultaneously. Luckily, specialists state your youngster has a lower possibility of getting the coronavirus by rehearsing well-being precautionary measures, which is why veils and social separating are so significant. If your child builds up the coronavirus, it presumably won't be serious or life-undermining. Affirmed cases in kids will generally have gentle side effects, as per the Centers for Disease Control and Prevention, CDC. In any case, serious complexities are conceivable, particularly for immunocompromised people or with hidden medical conditions. All things being equal, it's critical to be readied. Here are 7 different ways to bring down your family's odds of getting the coronavirus. Practice social removing. The coronavirus is a respiratory sickness like the cold or influenza. Polluted beads from hacks or wheezes can venture out up to 6 feet, and they can contaminate individuals by entering their eyes, nose, or mouth. New reports additionally recommend that airborne transmission might be conceivable through breathing and breathing out. This is particularly terrifying thinking about that COVID-19 might be asymptomatic, and it can likewise spread before individuals show any side effects, as indicated by the CDC. It's crucial to rehearse social removing guidelines set up by the administration. Remain in any event 6 feet from others, and dodge high traffic places where transmission is more probable. Be mindful in broad daylight places. Regardless of social removing orders, the vast majority go out for fundamental purposes like shopping for food. Try to play it safe. For instance, you can wipe the staple truck handle with a disinfectant wipe and maintain a strategic distance from direct contact with clerks. Peruse more about shopping for food during a pandemic here. Wear a cover. The CDC recommends wearing a material face cover in open settings where other social removing measures are difficult to keep up, particularly in zones of significant network-based transmission. Always wear a veil in broad daylight if you don't feel well, since the hindrance could hinder your tainted beads from polluting others. It's additionally essential to wear a veil if you're at a higher danger for genuine instances of COVID-19, for instance, if you're more established than 65 or have an undermined insusceptible framework. However, covers are not suggested for youngsters under 2. Decide on material or paper covers over N95 respirator covers, which ought to be held for healthcare laborers. Purify your home and possessions. As indicated by a March 2020 investigation from National Institutes of Health, CDC, UCLA, and Princeton University researchers, the coronavirus might have the option to get by for 3 hours noticeable all around, 4 hours on copper, 24 hours on cardboard, and a few days on hardened steel and plastic. That is the reason it's critical to clean key things in your home, for example, your ledges in the wake of setting staple packs on them, to bring down your odds of getting the coronavirus. Look at this rundown of different things to clean ASAP to forestall becoming ill. Show your children not to contact their countenances. Suppose microorganisms-ridden beads get into a youngster's nose or mouth. In that case, they can get debilitated with the illness, says Miriam Warman, Ph.D., science educator and overseer of the microbiology research lab at William Patterson University and writer of the handbook, Surviving in a Germ-Filled World. Urge your children to abstain from contacting their appearances out in the open. Ensure kids wash their hands. The most ideal approach to bringing down your odds of getting the coronavirus is rehearsing appropriate hand cleanliness, showing your children how to wash their hands with cleanser and water for at any rate 20 seconds. Ensure they tidy up before eating, whenever you get back from being openly, and before contacting their eyes, nose, and mouth. Likewise, you can utilize hand sanitizer within any event 60% alcohol when necessary, as indicated by Dr. Warman. Hand sanitizer has sold out in numerous spots, however. Look at our guide for making your child inviting form. Use alert when voyaging. The White House briefly restricted all movement from Europe, and the CDC presently suggests dodging all unnecessary worldwide travel. Look at the most recent rules and suggestions, and utilize your circumspection before setting out traveling. You'll have to gauge the advantages against the danger, says Dr. Warman. If you go via plane, stay away from individuals who look wiped out, wash your hands often, and purify common things like folding tables. Describing COVID-19 as a pandemic isn't a sign that the virus has gotten deadlier. Or maybe, it's an affirmation of the sickness' topographical spread. UNICEF has been getting ready and reacting to the pandemic of COVID-19 worldwide, realizing that the virus could spread to kids and families in any nation or network. UNICEF will keep working with governments and our accomplices to stop transmission of the virus and guard kids and their families. There's a ton of data on the web. What would it be advisable for me to do? There are a great deal of legends and falsehood about coronavirus being shared on the web, remembering for how COVID-19 spreads, how to remain safe, and what to do if you're stressed over having gotten the virus. In this way, it's critical to be cautious where you search for data and exhortation. This explainer contains data and proposals on the best way to diminish the danger of contamination, regardless of whether you should remove your youngster from school, whether it's safe for pregnant ladies to breastfeed, and precautionary measures to take when voyaging. UNICEF has additionally dispatched a gateway where you can discover more data and direction about COVID-19. The WHO has a valuable segment tending to probably the most much of the time posed inquiries. Likewise, it's prudent to stay up with the latest on movement, training, and other direction given by your public or neighborhood experts for the most recent proposals and news. How does the COVID-19 virus spread? The virus is communicated through direct contact with respiratory beads of a tainted individual, produced through hacking and wheezing, and contacting surfaces sullied with the virus. The COVID-19 virus may get by on surfaces for a few hours, yet basic disinfectants can kill it. What are the indications of coronavirus? Manifestations can incorporate fever, hack and windedness. In more extreme cases, disease can cause pneumonia or breathing difficulties. All the more infrequently, the illness can be lethal. These manifestations are like this season's virus, flu, or the regular cold, much more normal than COVID-19. This is the reason testing is needed to affirm if somebody has COVID-19. Remember that key anticipation measures are the equivalent: successive hand washing, respiratory cleanliness, spread your hack or wheeze with a flexed elbow or tissue, then expendable the tissue into a shut container. Additionally, there is an antibody for this season's virus, so make sure to keep yourself and your kid fully informed regarding immunizations. How might I maintain a strategic distance from the danger of contamination? Here are 4 precautionary measures you and your family can take to evade disease. Wash your hands regularly utilizing cleanser and water or a alcohol-based hand rub. Spread mouth and nose with flexed elbow or tissue when hacking or wheezing. Discard utilized tissue right away. Maintain a strategic distance from close contact with any individual who has cold or influenza-like side effects. Look for medical consideration early if you or your youngster has a fever, hack or difficulty relaxing. What is the most ideal approach to wash hands appropriately? Stage 1. Wet hands with running water. Stage 2. Apply enough cleanser to cover wet hands. Stage 3. Scrub all surfaces of the hands, including back of hands, among fingers and under nails, for in any event 20 seconds. Stage 4. Rinse completely with running water. Stage 5. Dry hands with a spotless material or single-use towel. Wash your hands often, particularly before eating, after cleaning out your nose, hacking, or wheezing, and heading off to the washroom. If cleanser and water are not promptly accessible, utilize a alcohol-based hand sanitizer with at any rate 60% alcohol. Continuously wash hands with cleanser and water, if hands are noticeably filthy. Would it be a good idea for me to wear a medical veil? The utilization of a medical veil is prompted if you have respiratory manifestations, hacking or sniffling, to ensure others. If you don't have any indications, then there is no compelling reason to wear a veil. If covers are worn, they should be utilized and discarded appropriately to guarantee their viability and keep away from any expanded danger of communicating the virus. The utilization of a veil alone isn't sufficient to stop contaminations. It must be joined with continuous hand washing, covering sniffles and hacks, and maintaining a strategic distance from close contact with anybody with cold or influenza-like side effects, hacking, wheezing, fever. Does COVID-19 influence youngsters? This is another virus and we don't know enough yet about how it influences youngsters or pregnant ladies. We know it is feasible for individuals of all ages to be tainted with the virus, however so far there have been moderately hardly any instances of COVID-19 revealed among youngsters. The virus is deadly in uncommon cases, mostly among more seasoned individuals with previous medical conditions. What would it be a good idea for me to do if my youngster has manifestations of COVID-19? Look for medical consideration, yet recollect that it's influenza season in the Northern Hemisphere, and indications of COVID-19, for example, hack or fever can be like those of this season's virus, or the normal cold, which are much more continuous. Keep on following great hand and respiratory cleanliness rehearsals like ordinary hand washing, and stay up with the latest with immunizations. So your kid is insured against different viruses and microorganisms causing ailments. Likewise with other respiratory diseases like this season's virus, look for care early if you or your youngster are having indications, and attempt to abstain from going to public spots, work environment, schools, public vehicle, to forestall its spreading to other people. What would it be a good idea for me to do if a relative presentations indications? You should look for medical consideration early if you or your youngster has a fever, hack or difficulty relaxing. Consider calling ahead to tell your healthcare supplier if you have ventured out to a region where COVID-19 has been accounted for or have been in close contact with somebody who has gone from one of these regions and has respiratory indications. Would it be a good idea for me to remove my kid from school? If your youngster is having side effects, look for medical consideration, and adhere to the directions from the healthcare supplier. Something else, similarly as with other respiratory diseases like this season's virus, keep your kid very much refreshed at home while indicative, and abstain from going to public spots, to forestall spread to other people. If your kid isn't showing any side effects, for example, a fever or hack, and except if a general health warning or other pertinent admonition or authority counsel has been given influencing your youngster's school, it's ideal to keep your kid in class. Rather than keeping kids out of school, show them great hand and respiratory cleanliness rehearsals for school and somewhere else, as successive hand washing, see beneath, covering hack or sniffle with a flexed elbow or tissue, then discarding the tissue into a shut canister, not contacting their eyes, mouths or noses if they haven't appropriately washed their hands. What insurances would it be advisable for me to take for my family if we travel? Anyone arranging an excursion abroad should consistently check the tourism warning for their objective nation for any limitations on passage, isolate prerequisites on section, or other significant travel counsel. Notwithstanding playing it safe and abstaining from being isolated or denied re-emergence into your nation of origin, you are also encouraged to check the most recent COVID-19 update on the International Air Transport Association site, which incorporates a rundown of nations and limitation measures. While voyaging, all guardians ought to observe standard cleanliness measures for themselves and their kids. Wash hands regularly or utilize a alcohol-based sanitizer with at any rate 60% alcohol. Practice great respiratory cleanliness. Spread your mouth and nose with your bowed elbow or tissue when you hack or wheeze and promptly discard the pre-owned tissue, and keep away from close contact with any individual who is hacking or sniffling. Likewise, it is suggested that guardians consistently convey a hand sanitizer, hack of expendable tissues, and sterilizing wipes. Extra suggestions include, clean your seat, armrest, touchscreen, and so forth with a sanitizing wipe once inside an airplane or other vehicle. Additionally, utilize a sanitizing wipe to clean key surfaces, door handles, controllers, and so forth at the lodging or other convenience where you and your youngsters are remaining. Will pregnant ladies pass coronavirus to unborn kids? There isn't sufficient proof to decide if the virus is sent from a mother to her child during pregnancy, or the potential effect this may have on the infant. This is as of now being explored. Pregnant ladies should follow fitting precautionary measures to shield themselves from introduction to the virus and look for medical consideration early, if encountering indications, such as fever, hack, or difficulty relaxing. Is it all right for a mother to breastfeed if she is tainted with coronavirus? All moms in influenced and in danger zones who have side effects of fever, hack, or difficulty breathing should look for medical consideration early and adhere to guidelines from a healthcare supplier. Thinking about the advantages of breastfeeding and the insignificant function of breast milk in the transmission of other respiratory viruses, the mother can keep breastfeeding, while at the same time applying all the vital insurances. For indicative moms all around okay to breastfeed, this incorporates wearing a cover when close to a kid, counting during taking care of, washing hands before and after contact with the kid, counting taking care of, and cleaning/sterilizing tainted surfaces, as ought to be done in all situations where anybody with affirmed or suspected COVID-19 connects with others, including kids. If a mother is excessively sick, she ought to be urged to communicate milk and offer it to the youngster through a spotless cup and spoon, all while following a similar contamination counteraction strategies. I'm stressed over tormenting, segregation and criticism. What's the most ideal approach to discuss what's going on? It's justifiable if you're feeling stressed over the coronavirus. In any case, dread and disgrace aggravate a difficult circumstance. For instance, reports are rising out of people worldwide, especially Asian plunge, being dependent upon verbal or even physical maltreatment. General health crises are unpleasant occasions for everybody influenced. It's essential to remain educated and to be thoughtful and strong to one another. Words matter, and utilizing language that propagates existing generalizations can drive individuals to get tried and take the activities they have to ensure themselves and their networks. Here are some do's and don'ts for how to discuss the coronavirus with your kids, loved ones. Do. Talk about the new coronavirus ailment, COVID-19. Try not to join areas or identity to the sickness. Keep in mind, viruses can't target individuals from specific populaces, nationalities, or racial foundations. Do. Talk about individuals who have COVID-19, individuals who are being treated for COVID-19, individuals who are recouping from COVID-19, or individuals who kicked the bucket in the wake of contracting COVID-19. Try not to allude to individuals with the infection as COVID-19 cases or casualties. Do. Talk about individuals securing or contracting COVID-19. Try not to talk about individuals communicating COVID-19 contaminating others or spreading the virus, as it suggests deliberate transmission and allocates fault. Do. Talk precisely about the danger from COVID-19, because of scientific information and most recent authority health exhortation. Try not to rehash or offer unsubstantiated gossipy tidbits, and abstain from utilizing hyperbolic language intended to create dread like plague, end of the world and so on. Do. Talk decidedly and underline the significance of viable counteraction measures, remembering following our tips for hand washing. For a great many people this is a disorder they can survive. We would all be able to take straightforward advances to keep ourselves, our friends and family and the weakest safe. How to stop COVID-19 with your community. Social separating is prompted, especially in areas that have a network transmission. Numerous nations have introduced isolate and social/physical removing as measures to forestall the virus's further spread. These measures can include the full or halfway conclusion of instructive organizations and working environments. Limiting the quantity of guests and restricting the contact between the inhabitants of bound settings, for example, long-haul care offices and prisons. Cancellation, forbiddance and limitation of mass social events and littler gatherings. Mandatory isolate of structures or local locations. Internal or outside fringe terminations, and stay-at-home limitations for whole districts or nations. Individual defensive gear. For individuals without respiratory side effects, the WHO doesn't suggest wearing a medical veil in the network, since it doesn't diminish the significance of other general measures to forestall disease. The single utilization of a cover doesn't discourage the illness, the veil's inappropriate utilization builds the danger of COVID-19 disease. In the WHO's recommendation on the utilization of covers regarding COVID-19 between time direction, the organized utilization of medical covers by health staff was stressed. To lessen COVID-19 transmission from possibly asymptomatic or pre-symptomatic individuals, the ECDC suggests the utilization of face veils. The utilization of face veils in the network may essentially fill in as a methods for source control. This measure can be especially important in pestilence circumstances when the quantity of asymptomatic yet irresistible people in the network can be thought to be high. Wearing a face veil could be thought of, particularly when visiting occupied, shut spaces, for example, supermarkets, strip malls, and so forth. When utilizing public vehicle, and for specific work environments and callings that include physical vicinity to numerous others, for example, individuals from the police power, clerks, if not behind a glass segment, and so on, and when teleworking is preposterous. In the United States, the CDC refreshed its proposals toward the beginning of April to encourage people to wear a fabric face covering, i.e., handcrafted covers or handkerchiefs, when in open settings where social removing is difficult to accomplish, particularly in zones with considerable network transmission. People should be guided to abstain from contacting the eyes, nose, and mouth when eliminating the covering, practicing hand cleanliness subsequent to taking care of it, and washing it regularly. The reason for the face covering is principally to contain discharges of and keep transmission from people who have asymptomatic or pre-symptomatic disease. The CDC likewise emphasizes that the face covering proposal does exclude medical covers, which ought to be held for healthcare laborers. People who are thinking about patients with suspected or reported COVID-19 at home should likewise wear a face spread when in a similar room as that understanding, if the patient can't wear a face spread. Social removing. Social removing is intended to lessen cooperations between individuals in a more extensive network, in which people might be irresistible yet have not been identified, subsequently not segregated. As maladies sent by respiratory beads require a specific nearness of individuals, social separating of people will diminish transmission. Social separating is especially helpful in settings where network transmission is accepted to have happened, yet where the linkages between cases is muddled, and where limitations put uniquely on people known to have been uncovered is viewed as inadequate to forestall further transmission. Models for social removing incorporate conclusion of schools or places of business and suspension of public business sectors, and abrogation of get-togethers. Out in the open business sectors where it is difficult to keep up social separation, impediment of the entered individual and empowering web-based shopping can lessen contact. Working environments are additionally one of the high-hazard regions for COVID-19 transmission. Therefore, home office working must be empowered if conceivable. In work environments where home office working is unimaginable, adherence to suggestions of WHO remains very significant. Studies have been led that help the irresistibleness of SARS-CoV-2 in the pre-symptomatic stage. Social removing is consequently of basic significance in setting up authority over the pandemic. Isolate. Isolate is one of the most established and best instruments of controlling transmittable illness flare-ups. This general health practice was utilized broadly in 14th century Italy, when boats showing up at the Venice port from plague-contaminated ports needed to moor and sit tight for 40 days, in Italian, quaranta for 40, landing there enduring travelers. The isolate of people is the limitation of exercises of or the detachment of people who are not sick but rather who may have been presented to an irresistible operator or ailment, with the target of checking their manifestations and guaranteeing the early recognition of cases. Isolate is different from confinement, which is the partition of sick or tainted people from others to forestall the spread of disease or defilement. Taking a gander at the writings accessible examinations, isolate is the best strategy in decreasing both the quantity of tainted and dead. It has been substantially more compelling in nations which started exacting isolate governs directly from the earliest starting point. In an article immediately distributed by the Cochrane Library assessing 29 examinations, results show that isolate can diminish the tainted quantity at rates from 81% to 44%. The quantity of dead from 61% to 31%. A numerical model done on the spread of COVID-19 in Italy indicated that without severe isolate rules, the pandemic couldn't be controlled. The quantity of auxiliary cases expanded concerning the size of families. As per the reproduction, if the family is contained 2 individuals and full isolate has been set up, expected auxiliary cases are 3 inside the 14-day time frame. With a family of 6, this number increments to 16. Despite over 2 months going after the principal case disclosure in the U.S., the calls to remain at home put out in 33 states and by numerous nearby governments were deficient. Then again, While it was extraordinarily scrutinized, the isolate and extreme principles applied by China's focal government to individuals from Wuhan implied that they had the option to successfully control the number of cases in states outside of Hubei that demise rates were decreased. In the flu pandemic in 1918, the significance of isolate measures was exhibited obviously. The most striking case of this originates from the U.S. The primary case in the city of Philadelphia, Pennsylvania, was seen on September 17. However, social limitations to forestall spread, for example, diminishing groups in broad daylight spaces, were founded on October 3, when there were 40 passings for each every 100,000 individuals. Shockingly, the measures initiated after this point were deficient, and by the center of October, this number arrived at 250 100,000th individuals. Interestingly, the primary case in St. Louis, Missouri, was seen on October 5. Social limitations were initiated on October 7, and both the quantity of cases and the pace of mortality were kept at low numbers. The WHO suggests that contacts of patients with lab-affirmed COVID-19 be isolated for 14 days from the last time they were presented to the patient. To actualize isolate, a contact is an individual who is engaged with any of the accompanying from 2 days before and as long as 14 days after the beginning of side effects in the patient. Having up close and personal contact with a COVID-19 patient inside 1 meter and for greater than 15 minutes, providing direct consideration for patients with COVID-19 sickness without utilizing legitimate individual defensive hardware. Staying in a similar close condition as a COVID-19 patient, counting sharing a work environment, study hall or family, or being at a similar social event, for any measure of time. Traveling in nearness with, inside 1 meter detachment from, a COVID-19 patient in any sort of transport. Dynamic observing of isolated individuals is one of the significant focuses for controlling the general public scourge. There are a few compulsory cell phone applications that control individuals consistent to isolated nations, for example, China, Japan, and Korea. In Turkey, with cell phone administrators' help, all people who are isolated are alarmed immediately when they move away from their area. Unquestionably, hindrance fines will likewise expand consistence with isolate. Cleaning and sanitization. High contact territories, for example, bedside tables and entryway handles ought to be cleaned every day with normal family disinfectant containing a weakened blanch arrangement, that is, 1 section Fade to 99 sections water. For surfaces that can't be cleaned with Fade, 70% ethanol can be utilized. Latrines and restrooms should be cleaned and purified with a weakened Fade arrangement, 1 section Fade to 9 sections water to make a 0.5% sodium hypochlorite arrangement. Expendable gloves should be utilized when cleaning or taking care of surfaces, garments, or material ruined with body liquids. All pre-owned expendable sullied things should be set in a fixed compartment before discarding them with other family unit squander. Garments, bed cloths, and shower and hand towels ought to clean utilizing standard clothing cleanser and water or machine washed at 60 to 90 degrees Celsius with normal clothing cleanser. Expendable gloves should be utilized when cleaning or taking care of surfaces, garments, or cloth dirtied with body liquids. All pre-owned dispensable tainted things should be set in a fixed compartment before discarding them with other family squander. Expanding testing limit. Another significant point in forestalling the spread of the sickness all through society is to expand the quantity of tests and pinpoint more cases, disconnect them, and follow the individuals who have been in contact. Hence, expanding research facilities' test limit and growing new testing systems are of most extreme significance. Different strategies, such as quick testing packs, serologic techniques, and self-gathered example tests, are being utilized worldwide to decide cases that thus help adherence to disengagement rules. In South Korea, which acted rapidly to control complementary and broad public testing for COVID-19, pass-through testing was started unexpectedly. The simplicity of its application, decrease in the quantity of individuals who applied to health focuses, and the ability to explore more individuals in less time show up as an effective system. Comparable applications dependent on this model are being established in Germany and different nations after South Korea. Avoidance and control measures in Turkey. The Turkish government actualized a few different control measures. These included social removing, travel limitations on guests showing up from high-hazard areas, isolate for nationals getting back from high-hazard areas, and conclusion of schools and specific kinds of work environments. On March 12, the administration announced that all schools including colleges were to be shut beginning from March 16. Turkey set up a few measures to restrict development of individuals. Residents 65 years of age or more established, patients with resistant framework lack, persistent lung sickness, asthma, COPD, ongoing cardiovascular illness, constant renal ailment, hypertension, constant liver ailment just as clients of medications that disturb the invulnerable framework were confined from leaving their homes and utilizing public transportation. All services distributed general directions on COVID-19 anticipation and control measures in their associations. As of April 13, roughly 40,000 tests have been reached every day with a sum of 73 approved labs, and the quantity of performed day-by-day tests is steadily expanding. Conclusion: in COVID-19, which has no endorsed treatment, it is essential to forestall the general public spread. The primary concerns in forestalling the spread in the public eye are hand cleanliness, social removing, and isolation. With expanded testing limits, distinguishing more certain patients in the network will likewise empower the decrease of auxiliary cases with stricter isolate rules. Shockingly, there is no medicine that has been endorsed by the FDA, experienced controlled investigations, and showed an impact on the virus for this worldwide pandemic. In spite of the fact that there are remedies for sicknesses and improvements took by jumps and limits in our day, the most grounded and best weapon that society has against this virus that is affecting health as well as financial aspects, legislative issues, and social request, is the counteraction of its spread. The interval direction distributed by the WHO on March 7, 2020, reacting to network spread of COVID-19, expresses that forestalling COVID-19 from spreading is through the improvement of coordination components in health as well as in zones, for example, transportation, travel, business, account, security and different segments which includes the aggregate of society. Preventive measures are the current technique to restrict the spread of cases. Early screening, finding, separation, and treatment are important to forestall additionally spread. Preventive techniques are centered around the confinement of patients and cautious disease control, including proper measures to be embraced during the conclusion and the arrangement of clinical consideration to a contaminated patient.